Hey, I'm Danguole Altman. I'm CEO of CX Precision Medicine. So, our mission is to accelerate the diagnosis of neurodegenerative diseases by empowering primary care physicians to triage dementia early. The problem we solve is that primary care really lacks simple and reimbursable tools to identify possible Alzheimer's cases, which then slows down diagnosis and treatment. Our solution is an AI-powered blood test designed for primary care settings, and that can help physicians quickly rule out patients who are unlikely to have dementia, and that can streamline the whole diagnostic process. In 2025, we have successfully completed the analytical validation of our test as a lab developed test in a CLIA certified lab. All of the other blood tests that are out there are amyloid tau based in some way, and their validations are all against amyloid tau pathology. And they're really meant, I think, along with the Alzheimer's Association guidelines that were published this summer, to really be done after a comprehensive initial evaluation at the specialty level, because they really should be taken in the context of people that already have had a cognitive assessment. You're really looking at their pathology. You're seeing which drugs either approved or in the pipeline would be appropriate for the patients. So for us, the more direct competition is with digital cognitive assessments, and especially their 2 minute or 3 minute quicker part of that test. And those are having a really hard time being adopted in primary care because there's resource constraints, both in terms of just labor, in terms of having space, in terms of being able to work with patients to be able to do those tests. So we actually see ourselves as complementary with all of the other blood tests that are out there. We would be that first kind of binary rule in, rule out. And then the next test really immediately should be one of those to really say, okay, this is someone that's gone past that, and let's figure out now what's really going on. Educating primary care is going to be really important, and we're launching actually with pilots. And I think educating people about what the test does and doesn't do. We are meant as a rule out test for people that have early symptoms of dementia. We're not a screening test, we're not a risk assessment test, we're not a rule in test. We're for some to be used for people who are presenting with possible symptoms to rule out. And if you're ruled out, that allows the primary care physician to say, what else is causing those symptoms? And if it's ruled in, we're not saying you have Alzheimer's or FTD or any of the other things. We're saying this is where you really need a deeper evaluation. Mostly that will be done at the specialty level. In some cases, it might be done if it's a multi-specialty clinic with a geriatrician or someone within that clinic that focuses on those patients. So it's really just a initial tool. We have done a bunch of survey work actually describing our tests in the context of the intended use, and it's been overwhelmingly positive. We've actually had almost 80%, it was like 78% of primary care doctors say that our test would be extremely valuable, even when presented with all of the other options. For us, being part of the Alzheimer's Moonshot community has really increased awareness both of CXPM within the broader community and also our awareness of other promising innovations. So that really opens the door for collaboration. So thank you for supporting early dementia diagnosis through innovation.